My name is Serik Tanirbergenov. I'm working at UNFPA Kazakhstan country office as a National Program Analyst on Sexual and Reproductive Health. The main message and the main idea of this reform that healthy teenagers today are healthy nation in the future. Young people in Kazakhstan, I think also around in the world, do not like to go to health facilities because in their point of view, health facility or clinic are the places of pain. Also, if a young person, for example, under age of 18 wants to go to the clinic, they have to ask mandatory their parental permission. And of course, the size of the country should be taken into account. The Kazakhstan is the 9th largest country in the world with a low population density. And this size requires to organize a comprehensive large network of health facilities. For example, in Kazakhstan, the network of youth-friendly health services before 2020 was only 100 youth-friendly health centers, like small places. But these 100 places, 100 centers covered only 1% of young people in Kazakhstan. Based on our surveys, research, young people in Kazakhstan are not habit of using contraceptives, and as well as their knowledge on reproductive health is low. Of course, it is big problems, and as a result, there are high rates of unplanned pregnancy, and the number of HIV cases among adolescents and youth has been increasing over the past few years. UNFPA, together with Ministry of Health, made a partnership to change the current situation. And we find that for changing these barriers, to changing this situation, we need, first of all, to change a legal landscape. It means a comprehensive legal reform should be introduced in Kazakhstan, and we do it. We develop a comprehensive reform to implement into the national legislation the important provisions on regulating access to healthcare for adolescents and youth. And now, after 2 years of reform, youth-friendly health services are opening nationwide. Every young person from the age of 16 is able to get youth-friendly health services without parental permission. And these youth-friendly health services are free of charge and covered by the national health insurance system. I think our experience, such kind of reforms, is absolutely doable and can be replicated in other countries, in other cultures. But to replicate this experience, I think everyone should take into account 3 main things. First of all, you need to customize the best practice, best recommendations, or another solutions into your local context. Second, don't be afraid to promote your agenda, to promote your ideas among society, among government policymakers or somewhere. And you need to find ambassadors, national partners who will support your ideas to promote among population, among society or policymakers. And number 3, this is very interesting case. This is very comprehensive to develop legal landscape, how health services should be regulated. And in developing such legal landscape, you need to understand what does it cost and how to promote this idea among policymakers.